And thank you for that, Fred. Ooh, we got a great big pink ribbon up there this morning. Welcome back. And we have Theresa Payne with us. Good morning, Theresa.
Good morning. How are you this morning?
I'm good. Hope you are. And so glad to have you here with us. Theresa's from Wilson Medical Center.
Yes, ma'am.
You are it's a mouthful, mammography technologist at outpatient imaging, at the Outpatient Imaging Center.
Yes, ma'am.
And, you know, I am a big advocate for breast cancer awareness. Being aware, getting your mammograms is so important. Tell us, I'll start off, Theresa, by letting you tell us how important is it?
Extremely important. Something that could take 5 minutes of 5 to 10 minutes can save your life.
Right.
It's so simple.
Yes.
It's just amazing to me how the fear of not having it done takes over getting it done. And when most people come in for that first mammogram, you bring them back, they just have that fear in their eyes, that look in their eyes, like all their friends have told them how terrible it was going to be, worst thing they'll ever have done. When they leave, they're like, golly, they're just like, I've had it done, it wasn't bad, I'll be back.
And after you get your result, and it's good, you're like, oh my gosh, I'm so glad I did this.
Yes.
I feel exonerated,
Yes.
I mean, really.
That and the fact that not only the fear of having it done, but I think the fear of the results is even bigger. Then they leave with, oh gosh, how long is it going to take? And our turnaround time is fairly quickly. We get the results within 24 hours. We can call the patients same day. If they have it done soon enough, we can get those results out to them quicker, and it just relieves that anxiety that they do have.
Sure. That's a natural, normal feeling. Well, statistics tell us that 1 in 8 U.S. women will develop invasive breast cancer over the course of their lifetime.
Yes.
1 in 8.
You think about that.
That's a lot.
And years ago it was 1 in 10. Now it's down to 1 in 8. And I think also the reason that has dropped is because more women are getting screened. So therefore, we're seeing more breast cancer.
You're seeing it more because it's more. They are getting more tests or screenings. It says an estimated 276,480 new cases of invasive breast cancer are expected to be diagnosed in women, along with 48,530 new cases of non-invasive breast cancer, which is what our PSA that you all are sponsoring is all about, that we run every day for the month of October, trying to let people know, look at the numbers.
Yes.
Please don't be a statistic.
No.
Please.
Well, the thing
about
get
it done.
Early detection as well is if you can catch it in the early stages, it's treatable and a lot of times curable.
Right, absolutely.
Get that mammogram.
How easy is it, Theresa? Walk us through people that are scared, young people that may be getting them and haven't had that much experience. Walk us through, what is it like when I go get my mammogram? What happens first?
Well, basically we the registration process, once we get them registered, we get them back, get them undressed, basically just from the waist up. So it's not like you're completely unclothed for the exam. It's basically just from the waist up. We take 4 pictures, 2 of each breast, and 1 at a time. The compression is just enough to hold the breast still. We're not there to compress the breast to make it uncomfortable, but we've got to have enough compression just to make sure there's no motion. Each exposure takes less than a minute and a half. We are doing 3D mammography now. It's kind of like the gold standard. Basically, it's if you were to take a book and open up the book and fan through all the different pages, we're basically doing that with 3D mammography. We're kind of thumbing through the book and looking at all the different pages versus one single view. We do a combination of where we do the 3D and we still get the 2D image at the end. So you're getting a complete.
So everybody gets a 3D.
Most of the insurances are covering those. I would say 90% of the patients we do the 3D. It doesn't, we're not doing anything differently, position-wise or compression-wise. The exposure's a little bit longer because it has to take time to get through all that tissue.
Sure.
But most of the women are saying it's not bad.
Right.
And it's not bad.
And it's not, it doesn't hurt. It may be a little bit of, maybe a little bit of discomfort, but wow, weigh the, discomfort to the result, what the result could be if you don't get one.
Oh, gosh, yes.
So, I've never had anything, before I went, like you said, before I went, ages and years, I won't date myself, but years and
I won't date myself. I've been doing it for about 35 years now, so we won't go there.
No, we won't. But, I can remember saying, my friends would say, it's just going to mash you to death and squeeze you down. And I get there, and, the technicians, and I know you are too, are so compassionate, and they are so gentle, and I thought, why did they tell me that? I was kind of mad.
Well, there's something about, everybody loves to put fear into some people.
Yeah, they do.
But when they get done, they're like, gosh, it really wasn't that bad.
Yeah, it wasn't
I'll be
that
back.
bad.
I'm here, ask for me. I mean, it doesn't matter. I mean, it's just being compassionate, understanding. I mean, if you have someone who comes in and it's that time of the month and their breasts are a little sensitive and tender.
Right.
It's just knowing that and just, being a little more gentle. But just if my patient has a bad experience, they're not going to come back.
Right.
So it's the experience they have.
Right.
If you give them that good experience, they're going to come back because I don't want them to leave with a bad experience and not have that mammogram.
Well, it's really a testament to you if they say, I hope I get Theresa this time. So that's kind of what you want. But, okay, let's say you tell me, okay, Sandra, I've took my 4 images. I need to take some more.
Right.
Then I start shaking and I start getting scared.
A lot of times it could be due to I'm missing some tissue.
Right.
A lot of times we do 4 pictures.
Right.
Some people have some larger breasts and you have to take extra pictures to get the tissue on
Right.
there. Or after reviewing the images, I may see a little motion.
Right.
But then again, I try to explain it to the patient, explain to them why, to educate, just letting them know what's going on. Why am I doing these extra pictures?
Are you allowed, and go ahead, I don't want to interrupt you.
Oh, yeah, no, that's fine. No, go ahead.
Well, are you allowed as a technician to say, well, I see a little something, or do you have to leave that for the doctor?
We leave that for the doctor because at the time I'm reviewing her images, it's really critical when the radiologists read their images, they compare them to their priors.
Okay.
If you've had prior mammograms, the radiologist will compare them, and that's how they see if they see any subtle changes going on in the breast. It's not, my place to do that. I don't have those prior images in front of me at the time, so I don't want them to leave thinking there's something there when in actuality there isn't.
Right.
It's something that's been there for years. It's all stable. That's a benign change.
Right.
But it's critical when patients do come into your facility and they've had outside images to let us know where they were so that we can acquire those images and compare them and make sure there haven't been any changes.
Well, I know the reason I asked that, I know that we're always anxious and we always probably aggravate the technician to death.
Okay.
Is everything okay? Is everything? I know you hear that. Everything okay?
Yeah.
So anyway, please understand that, and I know these technicians, such as yourself, get the best images possible for the doctors, and they're doing that, and then we should wait for our doctor. But I'm so thankful that for the team at Wilson Med that takes care of all the women and men. Now let's talk about men.
Men can develop breast cancer. It is not very common, but it can happen. They're quite fun to do because they come back on, their wives have told them all these things, but they're they're fun to do. But we do the mammograms on the men, the same thing that we do on women.
Okay.
It's not very difficult to do on them, and they go through the same process, but it's just not a screening tool for men. It's normally if they just have a breast lump that we do them.
And where are you located? Where do we get this mammogram at Wilson Medical Center?
We are at Wilson Outpatient Imaging Center. the WillMed Outpatient Imaging Center off of 1711 Medical Park Drive.
Okay.
You can access us off of Medical Park Drive or off of Tarboro Street. We have
Okay.
2 entrances. We're kind of tucked away in the woods.
Okay.
But come see us. And the other thing I want to stress too, I know with COVID-19, we're seeing a lot of patients that were due back in the spring and the summer that didn't come in due to not wanting to be exposed to anything. But please come out and get that mammogram. We do clean our equipment in between patients. We are masked. Patients are masked, so it is a safe environment to have that mammogram.
Very good.
So,
Glad you brought that up.
But so please don't let that deter you from not coming to get that mammogram.
Absolutely. Absolutely.
Don't let that be a deterrent.
Can we walk in, or do we have to have a referral?
We have, for a screening mammogram, we do not need a referral.
Okay.
You can call and make an appointment at 252-399-8900. That's our
Okay.
scheduling.
399-8900. Okay.
And we also do walk-ins.
Okay.
But it's just for screening, screening only.
Right.
If you are having a problem, you do need an order from your physician if you are
Okay.
having a problem.
Okay.
But yes.
Okay, very good. Well, it's easy.
Yes.
You can just walk right in. If you need a screening mammogram, then just walk right in, and the folks there will help you. Give the address one more time. In proximity to the hospital, is it kind of
It is
across the street?
across the street,
Okay.
directly across the street from the hospital. There's an
Okay.
entrance. When you cross over from the hospital on Tarboro Street, just keep going straight back, and we're in the building on the left, kind of tucked behind the trees.
Right.
Or off Medical Park Drive, we're behind the eye center,
Okay.
off of Medical
Very
Park
good.
Drive.
Well, thank you for everything you do, and
you.
now we're going to go over and talk to Jennifer about some of the services that Wilson Medical offers with breast cancer, their breast cancer services. So thank you so much,
Thank you for
Theresa.
having me.
And we'll see you next year.
All right.
All
Thank
right.
you.
Thank you so
have a
much.
great day.
We'll be right back with Jennifer. And welcome back again. We have Jennifer Page. Good morning, Jennifer.
Good morning. How are you doing?
I'm great. So glad to have your smiling face on here this morning also. And you are the Radiology Services and Outpatient Imaging Center Supervisor. What a job. Wow. You got to keep up with all that stuff.
Yes, ma'am. It's
Okay.
a busy job, but love to do it.
Very good. Jennifer's been at Wilson Med for 14 years, so that's good. So talk about some of the services with the other than, and I know we talked about the 3D and have talked about a lot of the services, but just to go over the services with breast mammography at Wilson Medical.
Okay. So each October we celebrate National Breast Cancer Awareness Month. And we do that to really stress the importance of screening mammograms and early detection of breast cancer.
Yes.
It's hard to, like Theresa was saying before, most patients are scared to come in and get it done, but breast cancer is the second leading cause of cancer death among women. So just that one simple mammogram, it takes an hour, one time a year, to go in, have that done,
Absolutely.
get that early detection done, make sure there's nothing there. At Wilson Outpatient Imaging Center, like Theresa said, we offer the 3D mammography, which is the latest technology in detecting breast cancer. Like she said before, we offer walk-in mammograms, so it's easy. You don't have to have an appointment. You can come Monday through Friday, just walk right in. There's no physician order needed
That's
as long
great.
for your screening mammogram. Come right in, have it done, go home. We do offer same-day results, like Theresa said. As long as we have your prior images, we can go ahead, the radiologist will read it that day. The technologists over there are amazing. They make you feel right at home. They make you feel comfortable. All the people that are involved with the radiologists that read it, they're great. You get your results back. We offer, if something is found, you'll follow up with your primary care physician. We have services that are offered. We have a patient navigator that if the patient does have breast cancer, a lot of times she'll get the information. She'll follow it with the primary care physician. She'll follow through with the patient. She'll kind of help the patient get scheduled for their appointments. If they need radiation, they go into our radiation oncology center. They'll see the oncologist there. And the navigator will follow them through each step of the process.
Wow, that is great. Because at that point, I mean, you do need somebody because you're kind of, oh, wow, what do I do now? So I think the navigator is very important.
Yes.
I think that's great.
And she's amazing.
Wow.
She's amazing. Her name is Lisa Skinner. And I don't know if you remember, she was on.
Yes, she did come.
Yeah, she's awesome. She does so much for those patients. She connects with them. She makes them. It's just when you're going through that, to have that one person to guide you through all of that is very important.
Yes.
And all the doctors in their care, whether it be Dr. Metz with our radiation oncology, they're just great. Mm-hmm. So
wonderful.
we would love for anybody and everybody, if you haven't had your mammogram, please, please, please come see us. It's so important. You want to get that first initial mammogram done. American Cancer Society recommends women ages 40 and older to have it done annually. So please come see us.
When would you start, Jennifer? You know, as a young person, you know, we have young people that watch. When should they start getting their first mammogram?
Well, like I said, American Cancer Society recommends 40,
So
but if
40.
you have risk factors, I would follow up with your primary care, kind of talk
What
with them.
about your family history? If you have a family history, would you come sooner?
That would be a question that I would speak to the primary care physician, but yes, you can have it done. I think it's the earliest is 35.
Okay.
But you have to go, 40 is when you can keep having them every year.
Right.
But if you do have a risk factor or you do have a family history, your primary care physician can send an order for you to have it any earlier.
Okay, very good. So, you know, we do encourage, that's what the Breast Cancer Awareness whole month, we're going to have, for the whole month, we're going to have doctors and these girls and everybody are so nice to come and talk with us and encourage. They're encouraging us to get our mammograms. So we appreciate everything Wilson Medical does every year to bring these girls here, and the information here is just so important. So we appreciate the service you are providing to the community.
Thank you.
At Wilson Medical, we really do. Jennifer, thank you so much. In parting, is there anything that we've left out that we need to?
I don't think so. If you have any more questions or want to just look up information, you can always go to wilsonmedical.com.
Right.
And you can see all of our physician services. If you don't have a primary care physician, there's physicians listed. There's a phone number you can call to get set up with them. So don't not get your mammogram just because you don't have a primary care physician. We can take care of those needs too.
Walk-ins are accepted.
Yes.
So, okay. Well, thanks again, Jennifer, and thanks to Theresa for coming today, and thank you to Wilson Medical Center for sponsoring this all month long. It's very important, so we do appreciate the community service that they are providing. So we'll be right back with you right after this. Thank you again.
Thank you.